Welcome to You and Your Pets. I'm Jim Horton, and I'm here with our resident expert, Dr. Ernest Rogers of the Maplewood Animal Hospital. And we have a special guest with us tonight. Dr. Rogers, would you introduce him, please?
It'd be a pleasure. It'd be a pleasure for me to introduce Dr. Brad Holmberg, who's a veterinary ophthalmologist who is with the Animal Eye Center of New Jersey and does specialty work in diseases and surgery of the eye.
So tell me, where did you study veterinary medicine, and how did you end up in eye diseases?
Well, thanks for having me, first of all. Appreciate that. Nice to be here. I went to veterinary school at the University of Missouri in Columbia, and I didn't actually get interested in eyes till later in veterinary school. Some people go into school with a specific focus, whether that's in cancer or in skin or something like that. At the beginning, I was open to all areas of specialty, and what really caught my attention was ophthalmic surgery. When I first had my first viewing of ophthalmic surgery, I was hooked immediately and couldn't get enough of it. And that's when I really got my interest in ophthalmology. And the nice thing that I learned as I continued to study ophthalmology is that not only do we get to do all these really interesting surgeries, but we also get to do a lot of medical treatment as well. And not just for one species, such as a small animal veterinarian that may see only dogs or cats, or a dairy veterinarian that only sees dairy cows, but I get to see all species, and that was really appealing to me, and hence why I am where I am today.
So you say you get to see all species, so tell me some of the species that you've worked on.
Yeah, so obviously mostly I see dogs and cats on a daily basis, and they're probably my favorite. But I've been fortunate enough to work with several zoos and marine communities, and as well as some raptor rehabilitation programs. So I've got to work with sea lions and hawks and snow leopards and walruses and dolphins and elephants and all types of very interesting animals, and feel very fortunate to have that experience and to be able to lend some of my expertise to those animals.
That's pretty amazing.
We have a couple of pictures.
Yeah, we do have, and they'll show the pictures, I hope, while we're talking. One is, I believe you're looking at a golden eagle. Is that correct?
So that's a picture of a golden eagle that I was examining. It had was brought into one of the rehabilitation centers that had been hit by a car. And,
oh my!
Unfortunately, a lot of raptors that get hit by cars, they do have ocular trauma, and if you have a lot of trauma to the eye, that can decrease their ability to hunt, and therefore may reduce their ability to be released back into the wild. Fortunately, this bird, we can see we're looking at its left eye, we were able to treat it effectively. It did not lose a significant amount of vision and was released back into the wild, so kind of a successful win-win for everybody.
I have to ask, because you did mention a large number of different animals, what is it like, what is the difference between, say, caring for an elephant, other than you're on a ladder,
sure,
and caring for a, well, in this case, you have a photo of a sea lion up. Are the animals, well, those are basically wild animals, first of all, so
Correct.
Do you have to sedate them before you can even get near them?
Some of them, yes. Other ones, for instance, the sea lion, that was a performance animal and was trained, and so we would get about a 3 to 5 second window to look at the animal. It would get a fish, and we'd wait another 3 to 5 seconds to look. So sometimes sedation would include fish and treats. And it can be a challenge to look at them. Some of the animals are very dangerous. I did some work for a welfare organization that rescues tigers, and those are animals that were in circuses and were unfortunately mistreated and were then sent to this welfare society, and so we did some volunteer work for them. And those animals, even though they had a history of being well trained, you still have to use a lot of caution. A big animal like that, you got to watch yourself.
But I think you also have to realize that there are dogs where Dr. Holmberg is within a couple of inches of their face. Often it's difficult to have a muzzle, and he's viewing their eye, not paying attention to them, and you hear a growl. And as a general practitioner, I've been in that situation. So
Sure.
We shouldn't really think only of wild animals. Our domestic animals, especially cats, they have 6 little extensions, their upper jaw, lower jaw, and 4 paws that they can get you with. So yes, it's very dangerous, and
Absolutely.
I have a lot of respect for him getting that close to them.
What kind of advanced education did you have to do, and how much longer did it take to become an ophthalmologist?
So our training is very similar to that of human ophthalmologists. So in humans and in human or medical school and veterinary school is very similar. 4 years of basic training and lots of coursework and clinical skills. And then it's a 1-year internship followed by a 3-year residency.
Oh, no kidding.
So about 4 years of postgraduate, post-veterinary school work before being considered a residency-trained ophthalmologist. After that period, you then study for just a little bit and take a very exhaustive group of examinations. And when you pass those, obviously, then you become board certified.
And I think we should mention that Dr. Holmberg also has a PhD in neuroendocrinology, which actually fits in well with ophthalmology. So he has many more than the 4 years post-veterinary to...
My parents wondered if I was ever going to leave school, so I'm out now. They're very happy about that.
What are some of the newer techniques being done in animal ophthalmology?
I like to think that veterinary ophthalmology really mirrors human ophthalmology, and we try to do everything that they do and to the level that they do. We all obviously have some limitations based on insurance reasons, as well as just anatomy and physiology differences between the human eye and the dog, cat, or animal eye in general. However, we're doing a lot more laser work. Our ability to do cataract surgery in animals has really rapidly progressed to the point that I do feel we're at a compatible level with human cataract surgeons, and our success rates are very high. So we're getting better at our techniques, we're getting better at our instrumentation as we borrow from the human field and again try to be at their same level.
So that does raise a question, one I asked you before we went on the air, which is, it was always my understanding that the older animals get, the more naturally they just lose vision and go blind, to where maybe by 16, 17 years their guide is their nose, but really not their eyes at all. Does that have to be true?
It doesn't. Aging affects us all, as I'm learning as I get older. And you know, for the eye in humans, if you live long enough, you're going to get a cataract. And fortunately, we can do cataract surgery, remove that cataract, and extend vision. In animals, it's really no different. And there are lots of aging changes that occur to the eye. Cataracts, of course, probably being the most common. And over time, the retina, kind of it's the film of the camera, if you will, part of the eye. It's what captures the image and then relays that image to the brain. That area can degenerate over time as animals get older. That's a huge area of research right now in human ophthalmology and veterinary ophthalmology. Is how do we get retinas not undergo these degenerative processes? And just recently, as a matter of fact, as of today, there's a paper published about doing stem cell research and trying to get retinas to function better. So I think the future is going to be really exciting for both veterinary and human ophthalmology to try to get vision even better.
And I think if I can just interject here, the retina is actually an extension of the brain. It's one of the few places we can actually see the brain in action. And so the ophthalmologist really has a window to the soul, if you want to look at it that way. There are many more diseases than simply eye diseases that can come about by an examination of the eye. So the ophthalmologists really have a broad interest in internal medicine as well as the eye. So
we do commonly see just common things like high blood pressure. We may be the first ones to detect it because we see those changes in the retina. So obviously an ophthalmic exam doesn't take the place of a full physical exam, and people should always go to their general practitioner for full exams on at least a yearly basis. But the eyes do tell us a lot more than just vision in general.
diabetic retinopathy is another,
Absolutely.
progressive retinal atrophy, and so a lot of things can come about. But as a general practitioner, I always refer to my colleagues who have the additional education and experience. And I think Dr. Holmberg would agree that the education helps. It's where you start from, but it's the experience that you gain in doing this over and over again
Sure.
that makes a difference between him, a new ophthalmologist, and me as a general practitioner.
Well, I have to ask, because I know, I recall you saying once in one of our programs,
Uh-oh.
Dr. Rogers, that, that a dog really sees with its nose. And so you have to be particularly very careful about what you leave around because they have such sensitive smell, and they also don't see anything but black and white. Isn't that correct? They're colorblind?
They do see in colors.
Oh, they do? Okay.
Dogs, cats, horses, etc. They are red-green colorblind, so they do see in blues and yellows. So your dog can discriminate between a blue toy and a yellow toy, and something that's black or white. They're like probably 30% of men out there who can't tell the difference between red and green.
I'm one of them.
So I don't mean to say this, but you have a dog's vision.
But I can tell the difference between a red toy and a blue
Good.
toy.
So, having said that, are there some breeds or are there some classes of animals, particularly birds, for example, where vision is a much stronger need than other classes?
Sure, and birds are probably the best example of that. Birds, without their vision, they unfortunately, as I mentioned before, can't hunt, can't eat, and therefore do die their sense of hearing. Unless you're an owl, their sense of hearing is not fantastic. It's not poor, but it's not fantastic. So they really rely on their vision. Other animals, such as some of our nocturnal animals, mice and rats, their vision actually is quite poor, and they do rely a lot more not only on their sense of smell and hearing, but even just the sensation of touch from their whiskers or vibrissae. And so Mother Nature's been amazing at picking what they need and making that their best organ for sight, whether it's their eyes, their nose, their whiskers, etc.
And I think if you look at it, you'll find the carnivores, the hunters, can use their vision a little bit better than maybe the herbivores, which are standing around.
Yeah.
And as a class, that makes a difference, and I think it makes a difference to the way you practice ophthalmology.
Absolutely.
You don't worry too much about a cow not seeing, but it's a bigger deal if a hawk can't
That was
see.
the question I was leading up to, which is, there must be some animals where if the animal starts to go blind, you say, well, not a real big deal, right?
Right. I mean, a cow's food doesn't run away too fast, while a lion's food is going to run away fast. So absolutely. And the way I usually explain it is the further your eyes are together, the more reliant you are on your vision. For instance, our eyes are very close together. We have a lot of binocular vision, ability to look through both eyes and see detail and depth. And so we're very reliant on our vision. Versus the more the eyes go lateral, you look at a horse who can almost see all the way around him. They're not that reliant on their vision for their daily activities. Again, they're grazers. They want to be able to see almost all the way around them. So if a predator is coming at them, they see that first. It doesn't matter if they know that the predator is a lion, a tiger. They want to know it's a predator.
Okay, well, we have to take a break. And right after the break, I'd like to go into some of these diseases, and this has been very good. Thank you very much. This is You and Your Pets. I'm Jim Horton, and we will be right back.
Television is a powerful and influential medium that allows different groups the opportunity to produce programming that directly affects their own communities. Public, educational, and government access channels ensure that all people, regardless of race, age, gender, disability, religion, or economic status, have access to local government information and the use of a public communication forum. Make sure everyone has a voice. Support your local PEG channels.
Welcome back to You and Your Pets. I'm Jim Horton, and we're here with our resident expert, Dr. Ernest Rogers, and Brad Holmberg, Dr. Brad Holmberg of the Animal Eye Center of New Jersey. And Dr. Rogers, I'd like you to take over this section and to go through some of the more common eye diseases that animals suffer. Would you do that, please?
Certainly, thank you. Dr. Holmberg, I know you see lots of eye diseases, and as an ophthalmologist, you must see some pretty exotic eye diseases. But we know that in New Jersey, and as a general practitioner, we see quite a few eye diseases that are really sort of common. Mm-hmm. And you were kind enough to supply us with some pictures that maybe you could comment on. I think the first one here is dry eye.
Correct. And while this picture probably looks pretty disgusting to most people watching on TV, really what we have here is an eye that has quite a bit of mucus stuck to the surface of it. And that's because right now this eye's not making enough tears. And tears are made of three things. They're made of water, which is the most nutritive part of tears, and that's when we cry, that's the watery part of our tears. But they're also made of mucus and a fat substance. And when you have dry eye and you're not making enough of the water component of your tears, you get a lot of that fat and mucus production, and that's what's adhered to the surface of this eye. The majority of cases of dry eye in dogs are due to an autoimmune condition in which the immune system is attacking the tear-producing glands of the eye. And treatment, fortunately, works in well over 80% of cases, and we can usually restore back normal tearing.
Right. And quite often what the owner will see at home is that the dog is continually closing and opening its eyes. We can also see that in the morning there's a lot of mucus around the eye. Mm-hmm. And that's usually when I see them as a general practitioner. It's, Doc, he has an eye infection. And I look at it and we do a special test called a Schirmer tear test. Okay. And we might also look to stain the eye to make sure that there's no damage to the eye itself. And we move on from there. Usually I can treat it with medicine. I mean, this is such a common disease that unless I'm getting into a concern with other problems, I usually just take care of it myself, but Dr. Holmberg is the expert. So you see an eye like this, as Dr. Holmberg pointed out, that has a lot of mucus on it and a lot of mucus around the eye. And so let's move on to our next interesting case. I think this is one that some of us might see and we might think, oh wow, that's an eye's been injured, and so this is an acute glaucoma.
Correct, and this is actually a real emergency. Glaucoma in people as well as in animals, by definition, by the simplest definition, is an increase in pressure inside the eye. And in dogs, the most common cause of glaucoma is a genetic or inherited cause with Cocker Spaniels, Basset Hounds, Beagles, Shar-Peis, Chows, etc. Those are going to be the most commonly affected. And what you're going to notice, the client's going to notice at home, is the eye's going to look very red around the edges, like you can see in this picture here. The surface of the eye may look either cloudy or hazy, and you may see a change in vision. And these are cases that we want to see right away. Either you want to go to your veterinarian right away or come see me right away, because as the pressure goes up, it doesn't go up slowly like it does in people with primary glaucoma. It goes up very quickly. And as the pressure goes up quickly, it does a lot of damage to the retina and optic nerve. And that damage can be not only severe but permanent, and can lead to a blinding consequence.
Right. What is the treatment for glaucoma in this case?
Yeah, so in this case, the goal, of course, get that pressure down. And we do that either medically or surgically. And just like in humans, sometimes medical therapy is sufficient. And when not, we have surgeries. As a matter of fact, we've had a run of them over the past couple days, in which what we do is, the goal is to turn the faucet off inside the eye, so to make less fluid inside the eye, and then open the drain of the eye to increase fluid outflow. The way we do that, just like they do in people, is we do a laser procedure to destroy some of the faucet part of the eye, and then we actually insert a tube inside the eye that's called an anterior chamber shunt. And by doing this procedure, what we do is we increase outflow and we decrease inflow, and by doing so we can maintain the pressure in the normal range as well as maintain vision.
That's pretty extraordinary. And I'm assuming that the animal is asleep for this whole procedure.
Absolutely.
I mean, and it must take quite a while to do that, right?
Well, to be honest with you, the procedure is relatively quick, and we try to do our procedures as quickly as possible, but of course as perfectly as possible. And the reason we want to do them quickly is we don't want to have a lot of trauma to the eye. We don't want to have the animal under anesthesia that long, and so we want to get in and get out as fast as possible. The procedure I just described before, which is called cyclophotocoagulation and a gonio implant, that takes about 45 minutes to an hour, so the actual surgery is not that long. Per eye, correct.
Right. And I'm assuming they're very tiny tubes, is that
Yes,
correct?
absolutely.
So you're working in really small dimensions.
Correct. So we do not all, but the majority of our procedures are done under an operating microscope. And so for us, in order to be able to visualize some of these structures, we have to look through a microscope.
And that's quite a challenge. That's a skill set in and of itself, working under a microscope where your suture might be the size of a hair, a human hair. Takes a little bit of dexterity, because you're not moving an inch, you're moving a millimeter to do the same motion that I might do when I'm doing a spay.
Correct.
And so it's a whole new skill set, which is one of the reasons why I refer to veterinary ophthalmologists. It's just many skills and many diseases that they see that we don't normally see.
I mean, I realize this is not a very bright question, but how long does it take you to be able to control your hands so you're not vibrating
Sure.
at the time you're...
Very steady hands.
A very steady...
I'm not a coffee drinker.
Is that...
And honestly, the surgery is challenging, and that's the part that I enjoy the most about it. But that being said, it's all about practice and experience, and it's something just like, no matter what you do for a living, the longer you do it, the better you are at it. And this is no exception. And I'm probably a better surgeon now than I was, 10 years ago when I was doing this, and hopefully I'll continue to get better and better. So like most things in life, it's just, practice.
Okay.
And again, just for our home audience, one of the things you might see when this initiates is the dog pawing at its eye, some pain around the eye. There might be some, what we call an injected sclera, and that's the red part you see around the eye in this picture. Unfortunately, many of the eyes I see have actually blown up to 20, 30, 40% their normal size. And at that point, it looks like as if the eye is completely dilated or the colored part of the eye is completely open. And unfortunately, that's probably the time when we've lost vision. So if you notice that your dog seems to be pawing at its eye, having difficulty blinking, those are issues that I want the owner to be aware of so that they can at least bring it to my attention, and then I can do the appropriate tests and then refer them to Dr. Holmberg if that's the situation.
Okay, what's the next one we have here?
The next one is something that I see quite a bit and I have variable success with. This is called a cherry eye by the breeders, and it's really a prolapse of the third eyelid. In dogs and cats, we have a third eyelid, which is something that sits in the corner, in the medial corner, or the corner closest to the nose, and comes up like an eyelid. It's a third eyelid. Dr. Holmberg.
And the purpose of that third eyelid is protection. It also acts as a squeegee to kind of disperse the tear film across the surface of the eye. But one of its most important structures is it actually contributes to tears. So the gland of the third eyelid, which in fact is the cherry eye, when that gland prolapses, we call it a cherry eye. That gland actually makes 30 to 50% of the water part of tears. And so when this gland prolapses, if we don't correct it, we may lose 30 to 50% of the ability to tear, and that can lead us to dry eye, which of course we saw the picture before. And so certain breeds, of course, are predisposed to cherry eye or prolapse gland of the third eyelid, and probably bulldogs are probably the number one by far, but Cocker Spaniels are also predisposed, and we can see it in any breed. So the treatment of choice is to surgically replace the gland, put it where it's supposed to be, and we do that with a technique called a Morgan pocket technique, and it's actually extremely successful surgery. There's only, what's reported is a 0 to 4% recurrence rate, so meaning it would pop back out again. And unfortunately, people have this idea that it pops out again frequently, and that's unfortunately incorrect. And actually, they tend to stay in very well. And once they're in, we get normal tearing, and that eye should go back to being a normal, healthy eye.
And I might just say, I'm a little older than Dr. Holmberg, I might just say that when I started as a technician in veterinary medicine back in the late 80s, the common procedure was to put a clamp on it, cut it off, sew it up, and that was the end of it. And that's when we started seeing a lot of dry eye. So we have progressed from not quite understanding the physiology of the eye to now we have people like Dr. Holmberg who can go in there, understand the physiology, and make the corrections in the best physiological sense for a dog.
And do we have another one now?
I think we have at least one more. Now this is something called an indolent ulcer, and it affects the cornea, and I'll let Dr. Holmberg.
Yeah. So an ulcer, in essence, is just a scratch on the surface of the eye, and they can be very superficial, very deep, infected, not infected. There's a huge range of corneal ulcers in dogs and cats, and this happens to be a dog. And one of the things,
if I can just interject and say, the cornea is the glassy part in front of the eye, and that's what we're talking about. We're not talking about the inside of the eye, but the glassy part in front of the eye.
Yeah, so just right on the surface. And so if you were to get a little sand in your eye or so, or get a little scrape, that would affect the cornea and cause a little ulceration. And these can be extremely painful. Imagine getting a piece of sand in your eye or so. Obviously, it's very irritating. And in this instance, this is a type of scratch on the eye of a dog that doesn't heal normally. So a normal scratch on an eye should heal within about 2 or 3 days. This type of scratch, in people, they're called refractory corneal ulcers, and we call them indolent corneal ulcers because they're lazy. They don't want to heal appropriately. So the treatment of choice for this is a minor surgical procedure, and there's several of them, but with the minor surgical procedure, they tend to heal very quickly with minimal scarring, and the animals tend to do very well.
Okay, we're just about out of time, so is there anything that you would like to wrap up with in terms of ophthalmology and animals that the audience should know?
Yeah, I think we should look at our animals' eyes as often as possible, because sometimes a very subtle sign can mean something very important. And so if you see something that looks different, an eye looks red or cloudy, there's squinting or discharge, those are signs that you should go talk to your veterinarian. And if your veterinarian's concerned, of course, they're going to contact me. And if you're severely concerned that there's been some trauma to the eye, don't wait. Get in to see your veterinarian, because the sooner we can see your pet, the better we can treat them, and of course, hopefully, maintain their vision and comfort.
Well, thank you very much. This has been You and Your Pets with Dr. Ernest Rogers and our special guest, Dr. Brad Holmberg, and thank you for watching.